Hello, dear organizers and participants of the conference. Let me present to your attention a presentation created by first-year students of the pediatric faculty of Saratov State University named after Разумовский, Власова Мария and Шатохина Яна. The topic of our presentation is swine flu is a highly acute contagious infectious disease. The choice of our topic is based on the fact that this topic is relevant since swine flu remains a dangerous and widespread disease today. Also, in December 2022, an outbreak of swine flu was registered in Russia, and there is every reason to believe that this disease can become a whole epidemic. Swine flu is the name for the influenza type A virus that affects pigs. Although swine flu doesn't typically affect humans, there was a global outbreak in 2009 to 2010. This pandemic was the first such flu pandemic in more than 40 years. It was caused by a then new flu virus known as H1N1. With these swine, bird, and human flu strains mixed together in pigs and spread to humans. H1N1 is now considered a normal type of seasonal flu. It is included in the annual flu vaccines. The Centers for Disease Control and Prevention reported that H1N1 was first detected in April 2009 in two 10-year-olds, a boy and a girl living in California. The global pandemic was declared by the World Health Organization in June 2009 and was over in August 2010. Worldwide, up to 575,400 people died from pandemic swine flu. Swine flu symptoms. H1N1 causes respiratory illness and is very contagious. Symptoms of H1N1 are similar to those of the traditional seasonal flu. Fever, body aches, loss of appetite, cough, sore throat, headache, fatigue, runny nose, irritated eyes. Causes. Type A influenza viruses have the ability to mix with other strains. This creates a new strain, which is what happened to cause the most recent H1N1 pandemic. Pigs are able to contract all three types of flu: human, swine, and avian. This makes them perfect vessels in which the virus can mix and change. The H1N1 virus was transformed in pigs, hence the swine flu name. This mixing likely happened a few years before the pandemic occurred.
Influenza circulates among pigs throughout the year but is most common during the late fall and winter. Sometimes pigs can pass the flu to farmers and other humans who work with them. People get the H1N1 virus the same way they get any other type of flu. They make contact with another person who is sick from either droplets in the air that contain leaf virus or by touching a surface that has been contaminated. They then touch their eyes, nose, or mouth. You can get influenza from eating pork. So you should always make sure that it's cooked thoroughly and handled carefully. Provider will be able to diagnose your flu by taking a swab from your nose and throat within the first 4 to 5 days of your sickness. There are rapid influenza tests that can tell if you have the flu or not, as well as which type A or B. Treatment for most people usually means comfort, care, and treating symptoms as they occur. And your flu shots now provide immunity against H1N1, meaning that swine flu has become a preventable illness. Thank you for your attention.